Good afternoon. My name is Kristen Dawn Hefner, and I am the Measure 110 Engagement and Strategy Manager with OHA, and I will be assisting with facilitating today's meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments or get on our interested parties email list by emailing oha.measure110@dhsoha.state.or.us. That email address and more information about the council can be found on the Measure 110 OAC website. OAC members have asked that OHA and other staff who are present in the meeting space please introduce themselves in the chat. Please share your role with the agency, and if you are a subject matter expert, your area of expertise. I will now hand it over to Sydney McConnell to take roll of both the media subcommittee members who are present and the full council members who are present.
Hi everyone. Apologies, I'm having camera problems on my laptop today, so I'm not on camera, but it's good to see you all. I'm just going to start with the media subcommittee role, and then I'll just make note of any other members who come throughout the meeting. Amy, are you here?
I am here.
Hi, Amy. Dharma, I do not see yet. Keisha was here, but I think fell off. Melinda?
I am here.
Hey, Melinda.
Hi.
Morgan, I believe, let us know she would not be here today. Is Onisha here? I don't see Onisha. Ron?
Yes, Ron's here.
Hey, Ron. And then Zeb also let us know he would not be here today. For other members, I saw Meredith. Hi, Meredith.
Hello, I'm here.
Hi. And then I saw Annalise. Hi, Annalise.
Yep, present.
Hi. And then Sabrina.
Yes, I'm here.
Hey, Sabrina. And that's all I see so far, but I'll keep note and welcome folks in the chat as usual.
Thanks, Sydney. So today we have some special guests for you all. We are joined by Health Resources in Action, or HRIA, who is the new Measure 110 telephone burn hotline contractor. They are taking over from Lines for Life in December, and they have a presentation for you all to introduce themselves and answer any questions that you may have about their plans for taking over this hotline. And so I think with that, I will pass it off to our HRIA team.
Thank you, Kristen. And yeah, we can see your screen, Kara. Thank you. It's great to be with you all. Thank you all for taking some time to meet with us today. We're excited to share with you a little bit about ourselves and get to know you as well. We are here to introduce our organization, Health Resources in Action, or HRIA, as Kristen said. We'll start by introducing ourselves before we really get into our presentation. So my name is Jen Siren. I use she, her pronouns. I'm Managing Director of Behavioral Health at HRIA. So in my role, I oversee and support all of our helpline work, as well as some other behavioral health related projects. And I'm going to pass it over to my colleague, Karen.
Hello, good afternoon, everyone. I'm Karen Schoeneman. I'm Managing Director of Health Communication at HRIA, and I have done work across all of the helplines or hotlines that we currently operate, and I use she, her pronouns, and I will pass it along to my colleague, Elizabeth.
Thanks, Karen. Good afternoon, everyone. My name is Elizabeth Reardon Hinckley. I use the she series pronouns. Happy to be here with you all and with my colleagues. I am the Senior Communities and Partners Manager across behavioral health programs here at HRIA. I do a lot of work on substance use projects. So anyway, really happy to be here. I'll pass it to Chelsea McCarran.
Thanks, Elizabeth. Hi, everyone. Nice to see you and meet you. My name is Chelsea McCarran. I'm the director of our helplines at Health Resources in Action. So I specifically work with our call center team, answering the phones for the helpline with our supervisors, managers, and the team. So very excited to be here as well. And I'll pass it over to Kit.
Hi, everyone. My name is Kit Spee. I use the she, her pronouns. I'm a senior communications associate here at HRIA, and I'll be working on the Oregon helpline. And I also work on the Massachusetts substance use helpline, and I will pass it to Kira.
You're still on mute, Kira.
Sorry. Hi, everyone. My name is Kira Robbins. I use the she series pronouns. I'm on the communications team with Karen and Kit, doing work across all of the helplines we help run. So it's so nice to meet you all.
Thank you all. So this is just a small portion of our team that you get to meet today. Hopefully you'll get to know us and meet more of us as time goes on. I'm going to start by telling you actually about what HRIA is before I tell you who we are. So we are a nonprofit public health institute based in Boston that's doing work nationally. We do work across many different areas. Public health services is where our helplines sit. We also have research and evaluation, grant making, capacity building assistance, health and racial equity, and more. We do many things at HRIA. And really that's what we do. But who we are, we just recently revised our vision, mission, and values. So I'm really excited to share them with you all today. At HRIA, we envision healthy people thriving in equitable and just communities. And to get there through our mission, HRIA partners with individuals, organizations, and communities to transform the practices, policies, and systems that improve health and advance equity. The way that we do that is through our values. So I'm not going to read you this whole slide, but to kind of introduce our values, HRIA seeks sustainable solutions for complex problems using an anti-racist approach. We aim to be adaptable and flexible in meeting clients and partners where they are, offering decades of knowledge and resources to collectively realize our dreams of equitable, sustainable health for all. And we do that through a lens of our core values of health and racial equity, leading with heart, collaboration, and innovation. So that's about HRIA. More specifically about our helplines. As you may have noticed, we have a very deep history in Massachusetts. So we have decades of helpline experience, particularly behavioral health related helplines, that we have had other helplines in the past. We've operated the Massachusetts Substance Use Helpline at HRIA for over 25 years and really have continuously evolved that helpline. We don't believe in kind of like resting with our laurels and the status quo. We really do strive for continuous quality improvement across all of our services. And for a really long time, we just did our work in Massachusetts. We were happy with that. But in 2017, we came across an opportunity to operate a helpline for the state of Illinois. At that point in time, I don't have a percentage. Most of our staff, the vast majority of our staff are based in Massachusetts still. It was a really pivotal moment for us to decide that we wanted to do work out of state, but we did decide that we wanted to go for it. We applied for that opportunity and won the contract for the Illinois helpline for opioids and other substances and began operating that helpline in 2017 and really have been able to build very deep relationship and connections in Illinois. And have been, I think, very successful there over the past 6 years. So since then, our helpline services have really grown. We've been operating the Vermont Help Link as well since 2020, as well as the Mass Problem Gambling Helpline since 2020. And in 2022, we began operating the Illinois Problem Gambling Helpline. And I'm glad to say that at this point in time, while we all started in Massachusetts, we now have staff in all of the helpline states that we serve. And that's our vision for Oregon as well. And we really kind of have a diverse staff on our team leading with lived experience. You can go back, Kira. And just not so much a focus on necessarily the academic credentials that someone brings, particularly to our screening and information specialists that answer our calls. but with a focus on the experience and overall approach that someone is bringing. And we do have quite a diverse team where you've heard of some of our roles as we were talking today. We also have a web team, a data team, other staff that are supporting the helplines in many different ways. And so it's really a robust team supporting all of these services that we'll be bringing. And I apologize if my voice cracks. I'm getting over a little bit of a cold. So I'm going to take a sip of tea while we go to our next slide. So beyond the helplines, we do a lot of other behavioral health work at HRIA. I'm not going to talk about this in detail, but really to share with you about our Behavioral Health and Racial Equity Initiative, or Be Here initiative. That is really our portfolio of behavioral health work at HRIA. The helpline does exist as part of it, but isn't branded as such. So two of our key Be Here projects are Be Here Workplace and Be Here Training. I co-direct Be Here Training, and some of the staff that are here today work as part of that as well. And it's really a suite of overdose prevention, harm reduction trainings for human service agencies. And as part of that, we have our You Can campaign, which is a storytelling campaign with the goal of decreasing overdose deaths in Massachusetts. And tandem to that, Project Note, which is an outreach initiative further addressing overdose, particularly with stimulant users. And we really share this to kind of share with you that we work across all of our teams, from capacity building, marketing, outreach, policy, and more, to advance behavioral health and racial equity at HRIA. And I believe with that, I'm passing it to Karen.
Thank you, Jen. Hello again. I'm Karen Schoeneman, and I would like to talk with you a little bit about our marketing and outreach approach across all of our helpline or hotline work, and what this could possibly look like for Oregon. We're at the very beginning stages of this right now. And, you know, as kind of representing for the purposes of today's discussion, the marketing and communications team, our charge really is to build awareness of the hotline, to create recognition. We want people to start to recognize it over time, and ultimately really create demand for hotline services. We do this by building marketing strategies and marketing content that reaches our primary audiences, and it really needs to appeal to them. And really the way we best do that is by appealing to people emotionally and engaging them emotionally. For us here at HRIA, that really means that we need to be grounded in a brand that has meaning to our audience, and that really makes a promise to them. And for us, that promise is creating connection. We don't necessarily use these exact words in all of our marketing activities and materials, but this essence of our brand is really true across all of our helplines. And we do anticipate that the same would be true in Oregon. And we'll talk a little bit more about this, but this essence of our brand really creates the foundation of all of our marketing work. So for many of you, I'm sure this really profound statement and concept is familiar to you. The opposite of addiction is connection. And while that has many different layers and there are many different sort of facets to it, we really see connection and human connection as a protective factor wherever people might be on their journey, as we talk about substance use and behavioral health. We really aim to create and to foster human connection at every touch point with the helpline. And some of the most obvious ones may be the phone call that gets made, a text, a chat, and we aim to foster and build connections in even deeper ways. We'll talk a bit more about this as well. My colleague Elizabeth will talk about this, but leveraging and building on community that exists and then further building it is one of our goals through our Champions program as well. Let's go to the next slide, please. I'm not going to read through all of these, but the many ways in which we aim to create connection really align with our overall larger approach to substance use and behavioral health work, and to our organizational mission of advancing equity. And this means for us very much centering those who are most impacted and honoring lived experience. As much as possible, we aim to feature the real people telling real stories, sharing their own experiences of very diverse journeys through substance use and recovery. We create Helpline Champions programs in some of the states in which we operate, and honor the role and the power of community in wellness and in keeping people safe. And that is inclusive of harm reduction, those who may be using or actively using, all the way into treatment and recovery. And we also explore the roles that racism and other kinds of systemic oppression have played in creating inequities, and work to advance the narratives, policies, and practices that can help create that really significant transformative kind of system change that is ultimately what we're all working toward. Now, to get into something that I think is hopefully a little bit more engaging, maybe, we're very excited to share a couple examples of our marketing work across various helplines. And I'll very briefly share with you what some of our marketing strategies have looked like, and we'll be exploring what this might look like for Oregon as well. Our strategies do vary across states, but they generally include some combination of strategies and activities and tactics, including outreach and partner and relationship building. That's really key to how we operate and how we show up at our work. Print and promotional materials. We do branded or organic social media for some of our helplines. And of course, paid campaigns that can involve things like search engine marketing, display ads, social media, paid social media advertising, video ads, out-of-home ads, and so on. And as much as possible, and we've been able to do this in a vast majority of our marketing, all of these materials, all of this content is grounded in the experiences and the stories of real people. And so that's what we want to share here. We'd like to start with Teresa's story. Teresa is in Vermont. She is both a provider and a person with lived experience. And this first video that we're going to share with you is a short one. It's a 30-second video, which can be used in multiple ways. Of course, it can be found on our website, but it is also the foundation of some of our paid work in Vermont. So it can be used across broadcast television and in streaming services and other kinds of online video services as well. So let's take a look at Teresa's story.
Harm reduction is more than just overdose prevention. Is when you can be compassionate towards another person and say, hey, I care about you. It is about respecting and treating people who use drugs with dignity and allowing them to have a voice. The people that we serve always come first.
Thank you, Kira. And we'll take a look then at another video. And what we, as as much as we can, as finances, as resources allow, we actually aim to create longer format videos as well. People have much deeper stories than can ever be shared in 15 or 30 seconds. And we do our best, knowing that people do sometimes have limited attention spans in sharing that deeper story. And we make longer videos available on our websites so that people can come to those websites and really, I think, start to feel a little bit more of that human connection by being able to hear more about individual stories. So next we'll take a look at Dallas's story, and this is a longer one, about 2 minutes or so.
I always say that the drugs and alcohol wasn't the problem, that was the solution to our problem. And today I have a better solution. And that's, turning to my family, turning to God. I'm asking for that strength. I work as a volunteer for the Sheriff Department. It's helped with me, giving back. When I was in that black hole, somebody jumped in that black hole and pulled me out of it. And I'm just doing the same now today. Always told by my grandmother, when you make a mess, you gotta clean it up. But I go back in there to show people that it's possible, change is possible. I don't have all the answers, I don't have all the solutions. I'm over 4 years sober, and still to this day I reach out. I cannot do this on my own. It's not just me it's affected, it's my family, my loved ones. When we in the middle of our addiction, we don't see that, but they affected just as much. For anybody that's out there that's supporting loved ones, we have to be there and give them that hope and believe in them. For people that's still in that black hole, I just let them know I'm truly there for you and I'll be waiting for you. This is my purpose in life today, to work and to give back. I always encourage people to don't feel ashamed. We have to reach out and we can't beat up on ourselves. Once we get over that shame and guilt, our recovery and healing process begins. Hope is here.
And I believe that video featuring Dallas is the perfect segue for me to hand it over to my colleague, Elizabeth.
Thanks, Karen. It's always good to see Dallas up there. Dallas became, he started with our helplines as one of our helpline champions, and I'll talk about that in a moment, this champion program that we have. I have been doing helpline outreach for Massachusetts since 2016, and want to share with you a little bit about what that looks like, because we are excited we have a job description that is posted, and we want to share with you because we want to have an outreach person on the ground in Oregon as well. So what we've done in Massachusetts, and I have not done this alone, and I'll talk a little bit about what that looks like in a moment, is really starting by identifying and prioritizing communities most impacted, by the opioid epidemic, fentanyl epidemic, meth epidemic that is happening in our communities, racist drug policies, barriers to accessing services, and other things that affect folks. So really looking at the communities that are being affected and prioritizing them. Our helpline can serve anyone who calls us, but we do want to make sure that those folks who are being impacted the most are reached out to. Our outreach is firmly grounded in relationship building. I have really tried to build relationship over time with communities across the state, with individuals, and really part of that is just keep showing up at things, at events, at meetings, at task forces, for coffee, and really acknowledging and building upon community strengths and assets. So we want to look at where folks are being impacted, but also all of the assets that are, that exist in communities across our states. So yeah, really, I work very hard to build trust, to work on building relationships with folks so that they know me, that they know the helpline, and we try to bring any learnings that I have on the ground throughout, particularly here in the state of Massachusetts, back to our helpline call takers so that they can understand what's happening on the ground, what amazing programs are popping up, and what people are doing so that they can better than serve the callers. And I'll talk about this in a moment, but I think as someone with lived experience with a substance use disorder, I always want to acknowledge, that this is heartbreaking work often, and want to make sure that we're holding space for that, but also celebrating the movement toward change that so many of us are doing on a daily basis, and celebrating all of those small changes that we're making towards healing. And so we do that in a few ways. And Kira, if you don't mind going to the next slide. I think back in 2016, I realized very quickly that even in a fairly small state like Massachusetts, it was almost impossible for me to do outreach by myself. And so I also recognize very quickly that there are amazing people across the state already doing work, already engaged around substance use work, recovery, harm reduction work, and they were embedded in their communities already. So I started by just having coffee with folks and telling them about the helpline, and really engaging with them, and then having them bring the helpline into their communities. And so part of the reason that I feel like this has worked so well is that, we aim to really engage and inspire community members to share the helpline in their own community in whatever way works best for them. So that sometimes is a hair salon or a barbershop, sometimes it's a laundromat or a local bodega, sometimes it's a task force they're on. So it really can look any way that makes sense to them. Because I really believe that people are experts in their own communities, and that they already have these existing trusted networks. And so we in Massachusetts have over 100 helpline champions. We meet monthly, and really those monthly meetings are to share learnings, to skill build together, and most importantly, to build relationship with one another. And it's just a really beautiful space. We also have a helpline champion program in Illinois. Those two programs have come together a couple of times, and we're, depending on what makes sense for Oregon, I would love to see this model replicated. And one of the beautiful things, and then I'll stop because I could talk a lot about our champions, about the program, is that it really is organic to the state that it's in, to the communities that it's in, and really, again, trusting those individuals to know their communities best and do what's best for them. So excited to share this with you, and hope to talk more as we move forward. I'll pass it to Jen.
Thanks, Elizabeth. And no matter how many times I see Dallas's video, it always it really touches me, brings tears to my eyes. So thank you for sharing it again. So that is a bit about what we've done in other helpline states so far. What are we going to do in Oregon? Well, we will begin operating what is currently known as the Recovery Center Hotline, or the Measure 110 Burn Hotline, on December 8th in 2023. So in really just a few short weeks, we will be running that hotline. And upon launch, what's going to happen is that we will consolidate the two local phone numbers into one toll-free number. So for quite a while, folks will be able to call any of those 3 phone numbers and reach us. So don't worry about any existing cards or flyers that are out there. All of those phone numbers will work for folks, but they'll also have the option of the toll-free number being added. We'll be accepting calls and chats from people in Oregon who are looking for substance use treatment, recovery, harm reduction services for themselves, loved ones, or clients, as well as accepting calls and chats for folks in Oregon who have received a Class E citation, and we'll be able to screen them, connect them with services, and provide them with the proof of their completed screening. So you may have noticed while I was talking that we'll be offering a chat service. So on December 8th, we'll also have a landing page that will go live online that folks will be able, I'll have some basic information, but I'll also have a live chat option that folks will be able to access our services through. So when someone calls or chats, they would be chatting with the exact same live people. It's not like a chat bot or something like that. So really excited to offer that service in the state of Oregon. And particularly with all of our staff being certified peers in Oregon as well. So that's what's initially going to happen December 8th. In 2024, we're going to be rolling out some additional services. So we'll build out that landing page into a comprehensive website that will maintain that live chat feature. Also have search options, more content for folks, things like that. We'll also offer follow-up services to consumers from our clinicians to make sure that they're able to access the services that we refer them to, or to make additional referrals if they need them. We'll also be developing and launching an SMS texting service. So at that point in time, folks will be able to reach us via phone, chat, or text, as well as promoting the hotline services through Oregon using outreach and marketing strategies, which Karen will talk about in a moment. Those are some of the key things that we'll be offering. We also have really robust data reporting, a feedback survey from folks, and really just kind of building beyond the Class E citations and really wanting to be a resource for folks who are in need of services in Oregon. So with that, I'll pass it on to Karen to talk a little bit more about the communications and marketing.
So this is, underway, and we'll actually get into the timeline in a moment. But we're aiming to really build on your existing current marketing and outreach strategies. Know that you have an amazing network there, both formal and informal. And, we really want to leverage that to be able to build awareness and ultimately use of the hotline. And so, as mentioned, we will be hiring a full-time person, on the ground person in Oregon as an outreach associate. We are embarking currently on our branding process. There will be a brand for the hotline, including a new name and logo and overall look and feel for the hotline. Jen mentioned we're going to be developing a full service website, and preliminarily we'll have an interim landing page just to make sure that everyone knows that we exist, and that really to make the phone call and have that interaction with a call taker. We will be developing initially palm cards or wallet-sized cards, and aim to increase distribution, make them as accessible as possible through the Burns and through the outreach associate. And we will be exploring whether other print materials might be useful. As a start, we proposed, and there was agreement about running a Google campaign. It's a pretty easy place to start, and that means both display ads as well as search engine marketing to make sure that the hotline shows up when people are searching for services in Oregon. And then last, we want to be exploring any additional strategies that would meet your goals, that would meet the goals of OHA. And it's very important that we are getting input all along the way. We are going to be seeking input and guidance from folks like yourself, partners, stakeholders, providers, and audience members to inform all of these things: the brand, the website, and the content on the website, other marketing materials and strategy, as well as our outreach strategy. And we will be having discussions with providers, focus groups, and also doing some online surveying. And then last, here is a rough timeline and focusing on sort of the major milestones. In early January, we hope to have an outreach associate hired and in place. We also aim to have our brand concept finalized and have something that we can really start to build upon relative to our other marketing materials in the website. And then a few weeks later, as we get into early February, we would like to complete print materials, make those available and accessible, and also launch our Google display ads and search engine marketing strategy. The other thing I want to call to your attention here on this timeline is that we are going to be holding two, we're just calling them for the moment, virtual introductory meeting spaces, almost like open office hours. We're still figuring out what's going to be most useful to people, and we really want to take the opportunity to create connections and start building relationships as well. Those meetings are scheduled for December 6th and December 11th. So more opportunity there for people across the state to learn more about who we are, what we're doing, and hopefully for us to be able to learn from folks as well. And I think that we wanted to open it up at this point. We do have a couple job postings for the outreach associate we've been mentioning, as well as for the project manager. Wanted to share those with you. I believe that we'll have the opportunity to follow up and share this slide deck as well. That will include all of the links for these job postings and our other helplines and any other links that we've included as well. We want to say thank you, and we're just very excited about this opportunity and how we are going to be able to work with you in Oregon and open it up to comments and questions.
Thanks, Karen. And I'll just note that in addition to sending these slides out, they will also be posted to our website following this meeting for anyone to access. Annalise, I see your hand up.
Thank you. And I'll just jump in. Nice to meet you all. Annalise Dolph. I'm a member of the OAC as the director of the Alcohol and Drug Policy Commission, and just recently in this position. So it may be some of my questions have been covered in prior sessions, but I do have a couple questions. I'm curious how in other states you have integrated or perhaps set it apart from 988.
Sure. So we do work closely, again, sorry about my voice. We do work closely with 988 across all of our states. So we do offer a different service. 988 is focused on kind of mental health crisis. And so we do often get folks who make it to our helplines who are in crisis, and we can get them over to 988 if that's appropriate, often via a warm transfer, so that the person's kind of never alone after they've connected with someone. And then we can meet with 988 to kind of coordinate with them, talk with them about referrals back and forth and things like that. And so often 988 will also get calls that are really more substance use specific, and they can pass them on to us as well. And so that's how we've worked with 988, I would say.
Can I ask one follow-up? And I could be wrong about this, but in Oregon, I mean, I think we're heavily relying on 988 as we move forward for our mobile crisis teams. So I don't know if we have a stronger connection here with SUD, but I think that's how it's been imagined. So I don't know if you're aware of that element or how you envision working with the mobile crisis teams.
We have not been coordinating with them yet, but I anticipate that we will be. I'm not sure if anyone at OHA has a more comprehensive response to that.
Yeah, I can jump in. And I think that is something that we will be working on once we get HRIA up and running and actually answering the calls. I think Ron, you had your hand up next.
Oh, hi. Hi. Thank you all for this wonderful presentation. I really am appreciative of the advertising and marketing and branding, using multiple layers to be able to communicate and advertise and market. I really like the videos. They were wonderful. I really like the intent and spirit of your programming. This is definitely seems like an organization with a heart and a solid purpose, and that's committed to diversity and equity, and I really appreciate that. I had like 3 things I wanted to try to tease out a little bit, because you mentioned, and this is probably more OHA will probably need to weigh in on this as well, but you mentioned that you have an advertising budget, marketing and advertising budget. My question is that built in? That you already, is it already pre-baked, or is that connected to, and this is the OHA part, the most recent legislation of House Bill 2513, which allows for the Oversight and Accountability Council working with OHA to spend money on marketing and advertising? That's my full question. Then I have 2 more.
Yeah, I can answer that one, Ron. So the marketing and advertising budget for the hotline is part of that contract and separate from any campaign that the OAC and OHA would conduct as part of House Bill 2513. So the marketing budget is baked into the HRIA contract and separate from whatever that future outreach campaign looks like.
So if there were, she mentioned, I think it was Karen mentioned that if they received additional funding, is that like a potential source of funding? The marketing and that, right, that's what I was getting.
That could be, yes, when that goes into effect in 2025, I believe.
Okay, great. So one other question, 2 other questions. Actually, I just realized I have 3. But the other is that one of the issues that we've kind of faced with the rollout of ballot measure 110, and particularly the citations, was the police officer or law enforcement kind of delivery or understanding, or how law enforcement understood what the citations were, what they understood what the services were, they understood what the role of the screening process was, and as a result, there was there's been some consternation at all kind of levels of understanding in populations. There's been some serious consternation around the citation process in terms of uniformity, the education of law enforcement, and delivery and actual connection people from the citations to the services. And I'm just curious, have you had any conversations about that? Because it's been a point of tension and consternation in terms of law enforcement engagement on this issue.
I would say that we're really scratching the surface at this point. We do intend to connect with law enforcement as part of our outreach so that we can make sure that they understand the services that we offer and our role that we play in the Class C citations for folks, and to hear from them about kind of any concerns that they might have about referring folks to us as well. So I think that is our plan going forward. I welcome anyone else from our team or OHA to jump in on that too.
Yeah, and again, I think that is something that we definitely want to enhance and improve on in the new year once we have this transition complete and the hotline up and running under HRIA.
Thanks. And the last question, actually, it's last and then a half question, because I think that half question will be easy. So, so currently, in terms of the way that the screening verification works, is that the council has provided kind of two avenues. One avenue is that folks call the hotline and they're able to get, the person is able to kind of verbally provide a release of information through OHA that then allows the screening entity to then submit a verification of screening, e-file verification of completed screening to the Oregon Judicial Department. So that's one way. The other way, which has been less visible and less operational, is that a person can get a screening at a burn provider locally in their community, sign a release of information, and then send that to Lines for Life. And then Lines for Life will submit to the verification of screening on behalf of the burn provider to the Oregon Judicial Department. And so my question about that is, have you been trained in that? And is that something that you're operationally able to pursue? Because for two reasons, there's only been a handful, less than, I'm sure, maybe less than 50 people who have completed screenings in the 3 years of the phone line. However, tens of thousands of people have received services in local burns. And so in my mind, there's kind of a disconnect between folks who are, so there's two things. One, that people are getting services and the services are being received, but there's a disconnect between the burns and the phone line in terms of getting verifications, because I'm confident in my understanding that there are lots of people who are getting services who have citations, but that information between the burns and the phone line isn't happening. And so that's the part that I want to try to nail down.
Yeah, Ron, I can actually answer that one. Currently, there is not a mechanism for Lines for Life or in the future for HRIA to e-file with the courts. OHA is still waiting on the instructions from the Oregon Judicial Department. We have been waiting on their instructions for, I believe, well over a year now, and have followed up with numerous calls, emails. We've escalated it as much as we can, but we do not have the court's instructions for how a provider can e-file proof of a screening on behalf of a client. So what currently happens is the client has to take the copy and file themselves with the court. So that is what is currently the state of play.
Okay, so so I can circle back with you on that, but it was my understanding that the council provided that a burn provider could submit to Lines for Life, and Lines for Life could submit.
And that will be the case once we have, with HRIA, once we have the court's instructions for how to file.
Right. I just wanted to make sure that wasn't. And my very last question is regarding languages, which is, will the phone line have bilingual number, or will there just be immediate access to folks who speak other languages, specifically Spanish?
Sure. So we are launching with English, and then shortly thereafter, we'll be adding Spanish options into our queue, and we'll be exploring with OHA additional languages to be added. We do currently have staff who speak English and Spanish, and access to an interpreter service with over 140 additional languages that folks can get a live interpreter on.
Thank you very much.
Thanks, Ron. And I just want to note a quick time check. We're almost at time. So moving on to Sabrina.
Yeah, this is more for you, I believe, Kristen, or for OHA. I was just wondering how it was decided, or why it was decided to go with out-of-state contractors instead of in-state contractors, or was there a lack of application or anybody wanting to do this work? Can you share that?
Yeah. So HRIA was selected through a competitive application process, similar to how all of the Measure 110 Burn Awards were awarded. OHA put out a request for proposals. We received a number of applicants and had a scoring grading process. And based on that criteria, HRIA was selected. I'm not sure if location was part of that decision process, but we can certainly follow up with you with more information.
Yes, I know we're cutting short, so it was kind of anybody nationally could apply for the work we're doing here locally in the state of Oregon. Okay, and then I was just wondering, did I hear it correctly when we said we're going to have, I heard multiple different positions. I was wondering how many positions are going to be staffing that line 24 hours a day?
So we have a staffing model that most of our screening and information specialists, who are the folks who answer the calls, chats, and texts, work across states. So we will have about 24 to 25 of those screening and information specialists available. But the positions that we're currently hiring right now are the project manager, which is specific to the Oregon Helpline, as well as the outreach associate that's specific to Oregon as well.
Thank you.
And Meredith, I know you had your hand up, so I want to make sure we can get to you.
Sorry, they asked the same questions. That was my question of like how many people they were going to have to cover the whole state of Oregon, and then, you know, how does this relate to the crisis line? So my questions were answered.
Great, thank you.
Thank you.
Well, noting that we're pretty much at time, if you have any additional questions for HRIA, please send them to Sydney and we will make sure that we get answers to you all. And we really appreciate HRIA for coming today and making this presentation. I believe our next media subcommittee would be on December 20th, which we can maybe touch base to make sure that we have enough people who would be interested in meeting that day, since I know it's getting close to the end of the year. Ron.
Yeah, I was just wondering, is this presentation going to be made to the full council?
We will send out a follow-up to the full council, since several members were unable to make it today. We have a lot of business we need to get through in the next couple sessions, but we can definitely have them back for the full council in the new year.
Okay, thanks.
Yeah. All right. Well, thank you, everyone. Hope everyone enjoys the rest of their Wednesday.
Thank you.
Yeah.